50% of the patients with a heart disease called aortic dissection die within the first 2 days of hospitalization. The aorta is the major blood vessel that carries the blood from the heart and distributes it all over the body. Aortic dissection is a life-threatening disease which starts with a tear in the aorta wall. The blood can flow into the torn cavity and tear the aorta wall further. The causes are high blood pressure, genetics, and old age. Doctors treat the patients with stents, which are metallic structures, to stop the blood flowing into the torn cavity and regain the size of the main aorta. Even though this treatment reduces the immediate mortality, there are certain post-surgery complications. The stent itself would cause the reoccurrence of the tear if it is too tight, or it can migrate inside the aorta if it is too loose. I'm using mathematics and computer simulations to develop efficient stents with increased patient survival rate. Every patient matters.